This is an LMC Community Conversation. I'm Maura Carlin. I'm speaking with Dr. Sherlita Amler, who is the Westchester County Health Commissioner. Thank you for joining us, Dr. Amler. Our topic today, not surprisingly, is COVID. We are 2 years into this pandemic, and people want to know when and how is it going to end? Dr. Amler?
I wish I had the answers for that, but I'm afraid there is nobody on the planet who really knows those answers. And so I get that everyone is tired. I think there's probably nobody more tired than the people who are in the healthcare industry or the public health industry. But the fact of the matter is that this virus, no matter how tired we are of it, is not tired of us. And so it keeps mutating. We keep getting new variants. And just when we think we've got everything under control, it modifies itself and things start all over again. I mean, we really had 4 spikes, as you know. And the last one, even though was less severe in its symptomatology, it was much more infectious. And so we actually had more people developing COVID than we had seen in the other 3 spikes before that. So I don't think there's an answer to that question, but my hope is.
Should we expect more spikes?
It depends on the variants. And this is what people don't understand. Every time somebody is not vaccinated and is susceptible to COVID, it only takes one person who gets COVID, who has a mutation. Every variant started with one person. That variant started in their body and it spread to others. And before you know it, the variants that are very infectious spread worldwide, and you end up with it across the whole world. The more people who are vaccinated, the less chance we have of variants occurring. So that's one of the reasons herd immunity is so important.
So how is Westchester County doing in terms of cases, hospitalization, death, and even vaccination and boosting?
Well, we're certainly doing a lot better than we were in the end of December. I mean, December 30th, we had over 6,000 cases of COVID in Westchester, new cases that day that were assigned out for contact tracing. I talked to my staff, and I think yesterday's numbers were like 257, and our positivity rate, meaning the percentage of people who get tested who are positive, is 6.1%. Back in early January, the positivity rate was 18.6% on January 10th. So, and it has been as high as 20% in January. So we're definitely doing better. This particular spike seems to be on the decline. Our hospitalization rates are going down. Deaths are a late finding because, person has to get COVID, get sick, end up in the hospital, and unfortunately pass. And so that finding tends to be, those numbers tend to trend down much later than everything else.
What is shall we call it the state of our immunity at this point? Many have been vaccinated and boosted, and many have also had it. But are we going to be worried about it declining again and needing more boosters, or should we all feel pretty good?
Well, some people are looking at studies that say if you had COVID and then you get vaccinated, you really get a tremendous boost in your immunity. And so they're saying, okay, great. I just need to get COVID and then I'll get vaccinated. What they fail to think about is the fact that every time you get COVID, you run the risk of serious illness and you run the risk of death if you get COVID. And so it's not really a safe option. So I wouldn't recommend that. But what I can tell you is that people that are fully vaccinated, from some recent studies, those that are fully vaccinated have like a 90% less chance of ending up hospitalized. So for me, the whole reason we vaccinate for any disease, not just COVID, but any disease, is to prevent illness and death. And so that holds true of COVID. And the problem is with these variants and with the vaccines, what we're seeing is that the immunity, we thought we'd get people 2 doses and we'd be done forever. But we now know that immunity wanes with time. And so now we're having to provide people with a booster dose. And that dose is very, very important because people who not only got vaccinated, but got their boosters are not getting sick. they're not getting infected with COVID the same rate as everyone else. And in fact, that's so true that the CDC has now said that if you're fully vaccinated and boosted, if eligible, meaning that if you had Pfizer or Moderna, it's been at least 5 months since your second dose, those people are not required to quarantine. And so people who only had 2 doses of vaccine are required to quarantine. So if you don't want to quarantine and you've had an exposure, the answer is, if you're eligible for a booster, get a booster. And that's especially true for anyone who is eligible. They've had 2 doses and their time frame is up. Now, people who got Johnson & Johnson don't have to wait 5 months. They thought they could get 1 dose and be done. But the reality is we now know that Johnson & Johnson, a single dose, is not protective. So people who got Johnson & Johnson need to wait 2 months from their dose of Johnson & Johnson, and then they can either get Pfizer or Moderna. They can choose, but they should get boosted. So,
we're going to need another booster in another 6 months or so?
Well, only time will tell. But what I do know is no matter how many vaccines I'm required to take, I'd much rather get the vaccine than get COVID and run the risk of having a hospitalization, dying, or ending up with long COVID, which we really still don't know what causes long COVID syndrome. And we don't know how long those symptoms are even going to last. And I hear a lot of people saying, yeah, but kids don't get sick. They don't get COVID. They do get sick. They do get COVID. They can get multi-inflammatory syndrome, end up in the hospital. They can get myocarditis. But the real risk is we don't know what the long-term impact is to children. And a recent report from the American Academy of Pediatrics indicated that children who had COVID had more than twice the risk of developing new onset diabetes following their COVID infection. So we don't know what the long-term impact is. I'm 60 plus years old. If there's a syndrome that's going to occur late in life with COVID, I'm probably not going to have that many years to worry about it. But if you're 5, you have a whole lifetime ahead. And since we don't know what the long-term impact is, I don't want my grandchildren to have to find out. So I absolutely made sure that they were vaccinated and boosted.
So what is the latest on younger children being vaccinated?
Well, we can't vaccinate children less than 5 still, but it looks like that is going to go before the FDA for emergency use authorization very, very shortly. And I think that within the month, we will have a emergency use authorization for children less than 5. Now, how far down they'll go, 6 months, 2 years, I don't know. We'll have to wait and see what it is. But I think, people may not realize that Moderna has got full FDA approval now. So both Pfizer and Moderna, so Pfizer for people over 18, Moderna for people over 18, Pfizer for anyone age 5 and over. These vaccines, have had a very proven track record. And we know that they're safe.
Well, Dr. Amler, thank you for spending this time with us. We appreciate all of your information. For Larchmont Mamaroneck Community Media, I'm Maura Carlin.